Salam alaikum. Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield, and this is a short video about Eid. Eid is coming. It's nearly upon us. My message to the people of Sheffield is, as it was a month or so ago, stay home, stay safe during Eid. Where we are in terms of the pandemic, the first wave is coming to an end. That's pretty clear. The numbers of people who sadly die is coming right down. It's now in single figures a day, and the number of people who are tested positive is coming right down. It's single figures a day. But none of the fundamentals have changed. We know that people from black and minority ethnic backgrounds have been far more worse impacted by this illness than the population as a whole. As I say, the fundamentals haven't really changed. So whilst we've passed the first peak of the infection, there still is a risk of infection, particularly if we don't practice social distancing and, importantly, hand washing. So the fundamentals are still there. We're asking that people observe Eid, but observe Eid differently, same as was for Ramadan. Gatherings still have a potential to spread the virus, and particularly to spread the virus to those who are vulnerable, medically vulnerable to having a much more serious illness. So if one person who's infected with COVID-19 attends a large family gathering, they could infect several or tens or maybe more people, some of whom will have underlying illnesses, and that puts them at much higher risk of a severe illness should they become infected. Also, we will all have the potential to carry the virus on our hands, whether or not we are affected or not. And if I'm then going back to my house where my grandparents live, I can infect them unwittingly and inadvertently, and I don't think anyone would want to do that. So we're asking people to avoid, during Eid, we're asking people to avoid large gatherings because they carry the potential for us to infect our loved ones and the ones that we hold dear to us. Imams have advised Muslim communities that they must pray at home and not congregate together for worship, and those restrictions continue. I think they will be continue into early July, and they may well be reviewed in early July, but those restrictions are in place at the moment. I'd personally like to thank the Muslim leaders of Sheffield who've worked really hard and definitely been instrumental in putting the lockdown in place within the Muslim community. So thank you personally for that, because it has mattered, it has made a difference, and it almost certainly will have saved lives. And people across the city continue to amaze us with their community spirit. So, I get the significance and the desire for people to want to celebrate in groups. I'd encourage you all to reflect on that carries significant potential for the spread of a virus, and particularly the spread of a virus to those of our loved ones who are more vulnerable or who may have a severe illness. I suppose it's worth me saying that a lot of people have said to me what about young people? Young people are least likely to listen to their elders. I know I got kids, and my kids don't listen to me, and they're least likely to follow the rules. We know that. There's plenty of evidence to suggest that. So anyone can catch COVID-19. Young people are less likely to have a serious illness, but you can catch it and spread it that way, or you can carry it on your hands. So if you're mixing with friends, you're probably breaking the social distancing rules, and you carry the risk of bringing that illness back to your loved ones at home. So and I'd encourage you to kind of think hard about that, because no one wants that, and we're trying to avoid a second wave of this pandemic, because we've all seen what it can do, and we want to avoid that at all costs. So thank you for your observance, and thank you for your continued support. It's mattered, and it has saved lives undoubtedly. But for Eid, again, as per previous for Ramadan, please celebrate Eid, but do so differently this year, and do so not in large groups.